Hyperpigmentation sucks. I know because I have melasma here on my face and up here. And in today's video, I'm going to talk to you about the different causes of melasma, how to treat it, and I'm going to share with you my personal treatment plan that I use every day. Hey folks, welcome to Natural Health Resources. I'm Dr. Melissa Gallagher, a naturopath, and I'm very excited to share with you some information that actually popped up ironically from some not so friendly commentary here on my YouTube channel. And if you are new to my channel, I hope you will subscribe and join our natural health tribe here. And if you are a regular viewer, you may have watched some of my videos that I filmed in the early days in the summer of 2014 and early 2015. And I actually had somebody comment on a video. I was talking about hormone therapy, and I'll actually put that link on the video that they commented about. And what the comment was, it was actually not so friendly. It was some commentary about how could I, as a natural doctor, talk about hormone balancing when my mustache here was showing. And so I wanted to clear it up. I do not have a mustache. I actually have minimal body hair. I don't have to do any waxing or anything like that. I don't really have to do a whole lot of plucking of my eyebrows. And what this is, I don't know if you can see it. I'm sure you can. There's kind of shadowing. It's above my lip. I've had that since I've been in my early mid-20s. And then more recently, this fabulous patch has popped up from pregnancy. And so I want to address for all the ladies and even men and all the teenagers, all the women that are hormonal, perimenopausal, menopausal, this video is for you. And I want to let you know a little bit about melasma because most of the time your dermatologist doesn't explain like the real root of melasma. Your OBGYNs and your internists and your rheumatologists and your endocrinologists and your varying doctors for like lupus and even cancer and thyroid disease, they're not talking about the ill effects of medications on your body that cause light sensitivity to UV rays and how it's affecting hyperpigmentation on the skin. And that is actually what I deal with. So many of you don't know, I actually, in my college years, I thought I wanted to be an attorney and I was going to save the world. And I ended up having a huge transition between my junior and senior year of college. And there was a group of 14 of us college students. We went to Africa, Tanzania, in fact. So true third world country. It was not a part of the UN. So there were State Department warnings about cholera, malaria, typhoid fever. All sorts of vaccines were required for that trip. And we were required to take malaria pills. And what I did not know and was not told by my GP was that the anti-malarial pills have a very high rate of developing hyperpigmentation. So that's this thing right there. It has never gone away. It's something I treat and manage daily, weekly, monthly, and seasonally. From the inside out and topically, which is what I'm going to share with you. So stay through to the end of the video where I'm going to have some information that you can download for free. But I also want to talk to you a little bit about pregnancy hormone right here. And I want to talk to you about the other medications that you're probably on right now and might be dealing with this and didn't even know, one, what melasma is, two, what causes it, and three, more importantly, some natural treatments and things you can do at home that are in your pantry and in your refrigerator that you can easily pick up. I'll provide some links down below in my bio and information where you can get some products that are great for helping kind of clear this up as best as it can be. So melasma is hyper skin pigmentation. It's basically brown splotchy discolorations that get really dark with sun exposure. As many of you know, I'm a Floridian at heart. I grew up in Florida. I spent pretty much all seasons outside I'm a runner and an enthusiast of sports outside, and I am also a hormonally somewhat imbalanced individual right now, as I am still coming off of my postpartum time. And so I think what I'm dealing with right now will resonate a lot with you, men and women and teens watching this video. So I want to start to break down the varying medical causes of melasma. So first and foremost are genes. So thanks to mom and dad for awesome genes. Sometimes genetically we're predisposed. If our parents have hyperskin pigmentation, it might mean that we're genetically coded for that. The other thing that is very common are birth control pills, hormone replacement therapy, and progesterone. Those three prescriptions can bring out the hormonal background of melasma. And I can say that I was on at least 2 of those. I was on birth control pills at the age of 14 for 10 full years until I had my naturopathic training and got off of that permanently. And even in the beginning of my pregnancy, I did take progesterone pills. So there you go. Thank you, hormone pills. Okay, so the other thing that plays a role is race. Some individuals are more prone to hyperskin pigmentation due to their race. Other medical profiles that are prone to melasma and hyperpigmentation developing primarily on their face, but it can actually be something that is on your arm, your shoulder, your décolleté, your chest. Thyroid disease, lupus, hypertension, yeast infections, allergic reactions to medications like antibiotics and aspirin and Advil, migraine medications, and even anti-seizure medications. That's actually just a handful. So some of the medical profiles that get impacted or are the cause of melasma developing with medication. So they couple up. You have a particular health issue, you take medication for it. Those two things with your family history ends up developing melasma. So I want to break it down. Thyroid disease is a big one. Thyroid imbalances, and I'm going to link to that video if you want to check out more about thyroid and uncommon thyroid symptoms that you can investigate if that might be something plaguing you. Stress is the second one. So there's actually a hormone that it's called MSH, and it is a hormone that actually produces more melanin in your skin and causes you to be very sensitive to photo or UV light. So stress can be a big factor. If you have had birth control pills and some of these other things, it sets up that kind of perfect storm where you will have melasma develop. The other common health profiles are folks that are on anti-seizure medications, and these are medications that are also prescribed for other health conditions. It's not just epilepsy or seizure disorders, but they tend to be drug-induced. Similarly, folks that might be taking hypertension medication, regular users of Advil, chronic yeast infections, or nystatin for yeast infections is a big offender. Bactrim as well, a big antibiotic. And I can say that when I was traveling through Southeastern Asia in my early 20s, that was my round 2 of malarial or anti-malaria pills. I traveled through China and Nepal, Thailand, India, and I feel like there was another country in there. But for about 4 months, I was taking anti-malaria pills and actually had the ability to go to a medical counter and had Bactrim as part of my treatment plan for a pretty intense bladder and kidney infection that I had after I left Japan. So for me, it was a combination of having been on birth control pills. The anti-malaria pills were really what kicked it off. Bactrim exposure, and even, nystatin, which is common for a lot of females. So what do you do about it? That's the big question. And this is something that I want to really impart for any folks that might be watching my video. I'm not wearing any makeup. I have some eye makeup on, like lip gloss, but we're really sensitive to this type of stuff. Men and women, if you have dark spots, especially, it's really common above here. You could dye the heck out of your hair and it's not hair, okay? It is pigmentation. It's in the layers of your dermis. The dermis has multiple layers. The pigmentation is deeper, and sometimes it'll rise to the surface. Sometimes there's phototherapy and other things that you can do. But the reality is we just have to manage it. We can manage it from the inside to the outside. But if you are being bothered by friends or family, or even people like myself, I'm putting myself out there on YouTube, and I had somebody really not nice comment about a mustache I have and how I could not possibly talk about hormone therapy because I was clearly hormonally imbalanced, which at that point was not the case. And that's another story about how I turned my fertility around. But people are mean, and melasma is really, really challenging. So I want to communicate what I do on a daily basis. So I've got my kind of my resource toolbox, if you will, for managing melasma naturally. I use lemon and I use apple cider vinegar. So these are my two top things that I do. So you can actually cut a lemon and you could smear either the juice, or I just sometimes will cut them in slices and I'll just smear this area. So this is, usually I do it after I've cleansed my face, but depending on the time, sometimes I might not do it in the morning, sometimes I might do it at night where I'm taking any eye makeup off. I just kind of smear it on there, and then with a cotton ball, I'll dab the apple cider vinegar. And so what these two things have been known to do, one, they balance your pH, two, they minimize inflammation of the skin, and that's something we're going to combat also on the inside. But they can help brighten. Lemon is great for brightening up the skin. So any type of melasma treatment is going to be brightening up, kind of minimizing those layers and really helping shed your layers as quickly and as successfully as possible, so that the sun exposure, we're sloughing off sun exposure and early kind of hyperpigmentation. The deeper pigmentation, which is what I have right here, that is something I'm always going to combat. This right here, this is post-pregnancy, really postpartum. This will resolve a lot easier, and I'm going to tell you some ways that I see that in my own life. I do this, the lemon and the apple cider vinegar, every day. The other thing that I use at night, and I only do this at night, is I use a glycolic, a 25%, you can see that, 25% glycolic acid solution. Glycolic acid is really great for sloughing off uneven skin tone, uneven hyperpigmentation. I couple that up with at least once a week, sometimes 2 or 3 times a week, depending on the season. Summertime, late springtime, I'm outside all the time. I'm exercising, I'm out with my toddler, lots of sun exposure. I have a hat and I have my SPF on, but it doesn't matter because I just tend to be way more sensitive, and this will really look like a mustache. So it's problematic. So this is a peel. So my glycolic solution, I use this underneath my evening moisturizing routine. So I'll do a smear of that, let it soak in. Then I do my hyaluronic acid, which that's another coupling agent. And if you see right there, I've got my Renew 5. That's my collagen that we'll talk about, and it has hyaluronic acid to help even up the skin tone. I will do the lactic acid green tea. It's a 25% peel. 25% is about what you want to get. Anything higher, you want to have an esthetician or a medical esthetician support your peeling, chemical peeling. I will also start my morning with lactic acid. You can see that. So I do these serums and I couple them up with hyaluronic acid and my good moisturizers that are going to support my skin with CoQ10, DMAE, and some other nutrients that will help keep things moisturized and keep things cellularly turning over. That's the key, cellular turnover. The other thing that I do, and I love Bliss Spas. I got exposed to them in the time when I was traveling for my career as a sales director for a staffing company. We actually used to travel to a lot of the bigger cities, and so a lot of times downtime I would hit the Bliss Spa in New York or Philadelphia, and even up in Boston. And I have such deference and gratitude for Bliss Steep Clean. It's an amazing combination. They actually have, it's a blue and a yellow serum, and you mix them together, and they basically, you mix them together and they turn green, and then you put it on your face. I like to mix in my hand. I'm gonna do like 2 pumps and mix these colors, hand, and then move it, smear it on your face. That actually is really great for kind of stripping. It has salicylic acid in it, has glycolic. It's just wonderful for exfoliating in a very gentle way, and it's not as intense as a peel. So I use that. And then internally, so some of the things that can set off or keep melasma in an intense state, or puts melasma in a situation where sun exposure really exacerbates it, you get really brown really fast, is inflammation. Inflammation internally, cellular inflammation, inflammation in the body and the digestive system. So there's things that I like to do and incorporate in my own personal program, and when I recommend for folks that are dealing with melasma. I love to make sure that I am consuming collagen and hyaluronic acid internally to support the turnover and the strength of the skin, the youthfulness of the skin, the suppleness of the skin. Similarly, the collagen will help turn over those cells so that when I'm doing my peeling, I'm getting much more lightening effect. So this is my Renew 5. This I've talked about. I'll link that collagen related video if you want to check it out. But this is Renew 5. It actually has collagen, resveratrol, biotin, vitamin C, and it has hyaluronic acid. I love. It's great for skin and nails, for hair. It's great for the digestive process, which will be a video I do, which a video that I shoot in February. But collagen is really essential for supporting any type of hyperpigmentation because it supports the cellular structure of the skin and actually has a healing effect from the inside out. Link in the bio down below as well to purchase the Renew 5 on Amazon. It's so great. Light sensitivity is something you just really can't avoid. And having grown up in Florida and being a person that's outside a lot, it's just nearly impossible to avoid. And when I'm in a clinical setting, I don't wear makeup. I usually have my hair back. I usually am tastefully and professionally dressed, and I don't wear any makeup. So a lot of my early videos were in between appointments and consultations and work with my patients. And it was very obvious that I had the melasma going on, as it is now. You can see it's wintertime here in Georgia, and so I have not had a lot of sun exposure. We went to Tampa recently, and this is popping up a little bit. But in all honesty, for me, I know that when I am finalizing breastfeeding with my little munchkin, this will be able to be addressed more intensely. But this right here, this is all anti-malarial pill cause and birth control pill cause, and it's unavoidable. So for folks that are dealing with this at home, I hope that you will check out this download. This is a free guide. I'm going to break out all those things that I do and a few extras that you can download and get today. All I need is your email address, and you'll receive that in your email box. I hope you'll subscribe to my channel. Thanks for tuning in today. Stay tuned for our next video where we're going to talk about lymphatic drainage therapy for the upper body. Have a great day, everybody.